within our statistical conclusion validity as well, we have to make sure that what we are testing actually has the ability to detect what we're looking for. So, for example, if somebody was to tell you, oh, this paper in front of you is made up of millions and millions of atoms, right? You would look at it and think it's a single piece of paper. There's no atoms there. It's one piece, right? Because your eyes don't have the ability to capture what's going on. If you were to look at the paper under an electron microscope, you would in fact be able to see the atoms. And this is kind of the point that I'm making with this is, do you have a test that is adequate for indicating what's going on in the relationship? And then likewise too, do you have enough of an effect size, which we're not going to go into effect size too much here, but effect size is essentially, does your research have enough power to detect what's going on? And once again, paralleling it to a microscope, does your electron microscope have the magnifying power to be able to see what you need it to see, or do you need a more powerful microscope? So type 1 error, let me go ahead and throw this out there. Incorrectly concluding that the null hypothesis is false, right? So essentially it's saying that there is something to see when in fact there was not something to see, right? So stating that the IV has an effect or that there is some sort of relationship between two variables, but in fact there is not, right? And what I want to make sure we're clear at is essentially when we set our significance or alpha level, 0.05 is typically what we use. This is the chance that we will make a type 1 error, the probability of us making a type 1 error. And of course, we want this to be as low as possible. So 0.05 is the highest, and then you just go lower from there. So ideally, we would have a very low low alpha level. The example I like to use in class is the autism and vaccination research that took place 15 years ago and erroneously reported that they were causational. Right? In this case, they concluded that there was an effect, but there was not. Right? So they rejected the null, accepted the hypothesis. Once again, not trying to push an agenda. Please make sure you read up on it if you disagree with what I'm saying. But in this case, a type 1 error. By contrast, you could also have a type 2 error. Right? A type 2 error is essentially failing to reject the null, right? When in fact it is false. Okay? So in this case, you're actually concluding that the IV has no effect or that there is no relationship, but in reality, it does. Right? The example I use too, and maybe you saw it recently about a year ago, all of this data came out about how bad sugar is for us. And apparently the sugar industry has been repressing this research for ages and ages because they knew. So they kept saying, oh, no, sugar is not going to hurt you. It's actually an essential part of your diet in small doses, blah, 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 blah. Reality is there is an effect, right? That the IV of sugar does have a negative effect on your health. So that's a type 2 error. The comic there is arguably the funniest or the most clever comic I've ever seen. So it's a bunch of bears wearing tags, and it says the purpose of this meeting here is to create a type 2 error. Right? So this would be the case that the scientists argue or hypothesize that bears do not meet in groups, and therefore they're meeting in groups just to throw off the research and create a type 2 error. I think it's funny. Anyway, let's move on. So some threats, like we talked about too, low statistical power. Right? So we have significance and we have measures of correlation, t-tests and stuff like this, but you also want to make sure that you have good statistical power. As I mentioned a second ago, this connects back to the metaphor of the electron microscope. So you want to make sure that you have enough data to correctly accept or reject the hypothesis. That's what this comes down to. Have you surveyed enough people? Have you examined enough interactions to know whether or not you can truly accept or reject a hypothesis? In this case, the best way to do so is just to increase your sample size. More sample size. A larger sample will give you more data and therefore give you more a better understanding of what's taking place and knowledge of whether or not you should actually reject or accept the hypothesis. And students always ask, well, how many people do you need in your sample? How much is a substantial sample? And I always say, well, how much money do you need? Because as much money as you might have, you could always have more, right? And that's kind of how we view it. So the largest sample possible, and of course we'll talk more about sampling in a subsequent lecture. So some other threats, and we talked about this in the lecture on artifacts. All right. So variability of the procedures. So this is a terrible picture of me in the bottom right, and that is a picture of my former colleague up in the top right, Dr. Aaron Smith. I say former colleague because it was at my previous school at Cal Baptist University. And what was interesting is her and I both taught sections of stats. And our students ended up getting very different scores as their final grades. And we taught from the same textbook, and we were going over the same concepts and everything like that, but the students were having very different outcomes. And the reason for this is because there was a variability in procedure. How she delivered the course and how I delivered the course ended up being very, very different. And this was largely accountable for the difference in the scores for the students. Likewise, if we were therapists applying the same therapeutic technique, we might both apply that technique differently and therefore create the potential for different outcomes in our participants. So you just got to keep this in mind that just because there's a similar protocol does not mean it's being followed exactly the same and delivered the exact same way. So anytime we have high variability in treatment, this can actually result in very, very substantial differences. Just as if, for example, just as if you were taking medication that required you to take it 2 times a day and you were only taking it 1 time a day, right? In that case, you are not following the procedure correctly and therefore might not get better as a result. Even though it's the same treatment, the same medication, your lack of following the protocol is making the difference in whether or not you are getting better or not. Something that people don't think about a whole lot. Obviously, whenever we do research and in life in general, we want diversity. Life is enriched by having a lot of different people, either in our study or in our lives, right? So this concept is kind of hard to explain in that we don't really want too much diversity. There is such a thing as too much diversity in our research. Just as there is such a thing as too little diversity in our research, we can also have too much. If you think, if we have a study that only contains one type of people, one group of people, right, that homogeneity is going to create kind of a bias in the responses. We're not going to get a good, diverse response set. However, if we have too much heterogeneity, too much diversity among the subjects, we can also kind of lose any ability to provide any conclusions because there is just such diverse data, right? So if you were looking, for example, if you were treating people or doing research on people with PTSD, right, you might want to consider things like comorbidity. Comorbidity is the situation where someone has more than one psychological ailment at the same time, right? So they might have PTSD, but they also might have anxiety or depression or alcohol dependency. Also, severity, right? The severity of the PTSD, you can have less or more severe PTSD. They're not always the same. The causes or the triggers of the PTSD. First responders get PTSD, as do servicemen and women. So the cause could make a big difference. And then also whether or not they've even been treated. All 4 of these factors, and these aren't all the factors, of course, but all 4 of these factors can create a very, very diverse participant pool, excessive heterogeneity. And this could lead to difficulty finding any good conclusions when dealing with a group that is so diverse, right? So what do? What's the answer? What I would suggest in a situation like this is try and be more specific about the subject pool that you're trying to achieve. Maybe you don't look at participants who have very, very severe PTSD, right? Just mild PTSD. You only look at participants who have combat or deployment related PTSD, no comorbidity, and no previous treatments. In that case, you've now eliminated 4 potential confounding variables and reduced the subject heterogeneity to a point that you should be able to conclude viable insights. Unreliability is a big deal. We've talked about it already, but I'm going to come back to it. Basically, can the test consistently measure the variable in question? It's also referred to sometimes as test-retest reliability. A scale, right, for measuring your weight. If you go to Walmart and buy a $5 scale, it is not going to be very reliable. There's a good chance that you'll step on it, get your weight, step off, step right back on again, and have a different weight register on there by maybe even a couple of pounds. That is very poor test-retest reliability. We want to make sure that whatever test we're deploying has the capacity to reliably test and retest scores. The SAT is a good example. A lot of intelligence tests are a good example. If you took an intelligence test today and then took the exact same test again tomorrow, you're arguably going to get almost identical scores. We want to make sure that it has good reliability, but a lot of it has to do with how accurate or powerful a test is. So if you have a cheap scale, you're going to get bad results. If you have an expensive scale, you should get more accurate results. Oh, there we go. Forgot that last bullet point. Finally, too, we want to make sure that we are not fishing with dynamite, right? We want to make sure that when we gather data, we know what we're looking for. We're not just simply gathering data so that we can run every analysis we know, trying to find something significant. That's not what we do, because the conclusions in that case will also be very, very weak and could be misleading. We want to make sure that we are looking for a single outcome or a few outcomes anyway, and we know exactly what we're looking for, right? You can catch a lot of fish by fishing with dynamite. It doesn't mean you're going to catch anything you can eat, basically, right? And the problem with multiple comparisons is that increases or compounds the potential error rate. So every test you conduct, even if you have a 5% error rate, if you conduct 10 tests, you now have 10 tests that have a total that each have a 5% error rate. So at that point, you're really dealing with more of a 50% error rate. This is one of the threats to your conclusions. So what you want to do when you think of experimental precision, oops, excuse me, there we go. What you want to make sure you do is try and hold any variables, any extraneous or confounds or artifacts constant or eliminate them if you can. Anything that you can keep from clouding the conclusions or altering the conclusions in a kind of confounding way, right? We really want to make sure we do that. So it comes down to good design and good execution, both before and during the study. They have to be both be there. Precision too. Sometimes you can be very, very precise and say this specific group on this specific day during these specific circumstances found this, and they're good results, but that doesn't mean they're generalizable, right? Case studies, for example, tend to be very, very precise, but they are not generalizable. Right? So just kind of keep that in mind. What are you trying to do? Are you trying to generalize to a large group of people, or are you trying to be very specific about what you're finding in this certain circumstance? Right? And then finally, don't overextend your conclusions. And this is kind of a facetious example, but you can't make conclusions about the social tendencies of mammals by researching the nocturnal mating habits of the red-banded lemur of southern Madagascar. Right? Essentially, if you are looking at a very, very, very tiny, nuanced group, you cannot generalize to the massive, larger group that they belong to. Right? Once again, going to the idea of atoms. Atoms, of course, have little things that orbit them, right? Electrons that orbit them, right? So if you look at it under a microscope and think, ah ha ha, yes, everything must orbit each other because these are orbiting. So if your molecules or atoms have an orbit, then everything else must have an orbit. Well, I don't have an orbit. There's nothing orbiting me. I mean, my children sometimes when they're hungry, but like you can't provide conclusions about the overall very large structure when dealing with a very, very small structure, right? So that's the idea is essentially make sure that your conclusions are all well supported and don't overextend the data that you collected in your well-designed and well-executed study.